and I am a psychologist, and I am part of member of Assure for Life. I am so glad to continue with this type of topics that we bring to you every 15 days. Today we're going to talk about mental health care in older adults. And in this case, I would like to tell you a little bit more about how we're going to talk together about this important topic that is the mental health. This is a space for reflection and learning where we can talk together and also understand a little bit more how we're going to deal with these topics or circumstances that we're going to live during our lives. Knowing this, and also having in account that we're going to talk today about the mental health in older adults, I would like to start to talk about what it is the mental health, and also talk about what is this important in the adults, because we're going to understand that the older adults have a potential risk to have some illness in this old age. Knowing that we consider older adults after the 15 years. So knowing this, taking account the kind of people that you know that have that age, even more, or if you have that age, take care of the topics that we're going to talk in this conference. Knowing this, we're going to start with some concepts. The concepts will be mental health in older adults, and also knowing this, we're going to mix it together, and then we're going to know a little bit about the risk and something that we can do to improve our mental health. Let's begin to talk about what it is the mental health. The mental health is not only a concept and is not only a stage in your life. We have to know that the mental health is circumstances, biological health, and also psychological state of mind. So we would like to provide you this slide with this short definition about mental health. We know that the World Health Organization have this definition, that is, the mental health is a state of well-being in which each individual realizes their own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make contribution to their community. Knowing this, we're going to understand that if we are healthy, we can have our potential and also bring them to our community. We can develop our abilities and also bring them to the community in the best way. So knowing this, also I would like to provide you other definition about what it is the mental health. Mental health is a state of emotional well-being. It's not only well-being in a physical way, it's also emotional and physical well-being that equips individuals to navigate life challenges and harness their abilities, engage in effective learning and work, and possibility to impact their community. So you can have some challenges in your life, as all we have during our life, but we can confront that or also encourage the circumstances in our life in a good way with the abilities that we already have, or also we can later develop. So knowing these different definitions that we have about what it is the mental health, we also have to know that we have different stages in our life that can compose us as a human beings. We are biological, psychological, and social. We have these factors and in our lives. So we have three factors: biological, psychological, and social factors that can give us one way of see their life in an holistic perspective. So knowing this can have or even give us one biggest way to see their lives. So if I am healthy with my body, and I am healthy with my mind and also with my emotions, I am in the 80% or completely mental health or health in a complete definition. We have also social factors that can impact directly with our health. So if we have social or external factors that can control us or maybe be dangerous for us, this mental health or the health will be in 80% or 60%, will be never 100%. So it's important to understand that we have these three factors also inside the mental health definition and concept. Now, knowing this, let's talk about what it is the mental health in older adults, because it's different to talk about this stage of life and also talk about the mental health in older adults. Understanding that mental health in older adults is a new concept, because before maybe 14 or 15 years before, we don't live that much that we are living now. Most of the people live until 50 or 60 years, and now we are seeing that the people can live until 80s, 90s, or 100 years old. So knowing this knowledge have some implication, because the human life expectation can increase with the time. So our generation can live not only until 80 years, we can live too much time of that. And also some studies says that we can live every single different generation more than 20 years. So will be more years every single generation next day. So knowing this, now we have other stage of life. We have more adult people in our society. So we have to think what kind of role in the society we're going to bring to the older people. And we have to also understand that the old age always will have illness. We're going to start to get older, and our body will be older too. So we're going to have some risks to have some illness, mental illness and physical illness. So this knowledge of the new society and this new stage of life that we're going to in front in some age, we have to understand that it's important to see the mental health in older adults as a social impact and also as a social responsibility. Understand that we have to go through this process and in the same way as mental health in a child and mental health in adolescents, mental health in adults, and also in the old age. Here we have an description in this slide where we can have little resume of what we would like to bring you in this specific topic about mental health in older adults. People age 60 and older make valued contribution to society as active family members, volunteers, and active participants in the workforce. These will be some of the activities that the old adults can develop in this stage, and that will be a good idea to create a new role during this stage of life. So knowing that they can develop some important activities in the home or even in the community, we can develop a new role for the older people. Now I would like to talk about one of the most important things that we have to take in account in this conference, and is the mental illness in older adults, because it's normal and also natural that we start to get ill or sick during this stage of life, and is trying to understand that we're going to live that, and it's normal because it's part of our life to get sick, and one stage of our life we're going to death as a result of that illness. But we have to understand and accept that it's something natural and it's something normal. And mental and neurological disorders among the older adults, like the Alzheimer and also dementia, as the common illness that we're going to confront in this stage of life. And also the depression is one of the other mental disorders that can appear in this older stage in their lives. So it's important to understand that if you have some signs or symptoms associated to this illness, try to communicate and look for the help in the present moment, in this moment that you think is important symptoms or is a signal alarm. Try to look for the help. I would like to give you an important date, and also try to understand that it's natural and is important to look for other way to understand this mental illness. The prevalence of dementia in individuals age of 60 and can have a range of 6.66 to 8.48 percentage. So we have normal and also common percentage of people that can have dementia after or during the 60 years. And every 20 years that will increase, that percentage will increase. So what we're going to talk about here, and also the purpose of this conference, is try to prevent and talk about this kind of signs or risks that the people or other people can also prevent before to start and also have maybe this kind of mental illness. And as I told you, one of the most common disorders, mental disorders that we mentioned, is the Alzheimer and dementia. But also we can have or also we can see as a common disorders, the anxiety and cognitive impairments and mood disorders, that is most of the common disorders, and also included depressive disorders. Knowing all these mental illness that can be associated to the older people and the older adults, try to recognize in your family, and also to, if you have this if you are in this stage of your life, try to understand and accept this stage of your life, and try to recognize if you have some signal alarms. Try to look for help and also consult with a doctor or a professional. Following this topic, and also following the mental illness important to recognize this, we have to talk about the risk factors and recognize signs of these risk factors. So generally, we can understand that older people or older adult have an age of 60 years old. So if you have a near person that have this age, or if you already have or have more of this age, try to understand and remember, if you see or if you know that these people, or if you have these signs, and understand that these will be risk signs or risk factors, okay? And it's important to be able to identify warning signs, and also potential the mental health, trying to avoid or prevent this kind of habits if you have, or even a person that you know have these dangerous habits in their lives. Let's see some of the risk factors in this old age. Changes in mood or energy levels. It's normal to have changes in mood or energy levels during our lives, but if it's something common for you, have a lot of energy even in this stage of your life, more than 60 years, and for no other reason you start to feel lazy, or you feel tired, or you feel with a lot of this sense of or you need to sleep all the time, and it's not common for you, and it's from a moment to other, is as a risk factor, because it's not common in your life. It's something that is that you are not ready to understand, and also that is not normal or common in your life. Also, alteration in eating and sleeping habits. If you have difficulties to sleep, this is important to recognize, because we're going to have different stage or even different moments in our life when we're going to sleep more than 10 hours. When we are a kid, we can sleep more than 10 hours every day. When we start to live an adult stage, we can sleep like 7-8 hours every day. But it's common in this old stage in our life, we can sleep like 6 hours. But it's not normal if you are sleeping, start to wake up suddenly without reason, or that you only can sleep 2 hours, 3 hours. That is a risk factor, and also take care of that. Isolation from previously enjoyed activities and people. This is a signal alarm, because try to be alone, and also be a part of the people that you love, or stop to do activities that you already enjoy, or you feel passion for something, and that suddenly you don't feel that passion, or you don't want to be with the people, it's a sign of this. It's a risk factor, because in this stage of life, we're going to talk about that later. It's really pretty important to be a companion with the people that you love, of your family, friends, even of your children. If you decide to, or even you decide of isolation, it's important to understand and also realize what is your decision and why you're taking that decision in this stage of your life. Unusual feelings of confusion, forgetfulness, anger, distress, worry, or fear. It's normal to be, I don't know, if you have confusion, or maybe if you are distracted for no other reason, or an external factor, but it's not normal to feel confusion in a common way or in a common situation if you always know your routine, or even if you know the route to go from your home to the church or to the market, and suddenly you don't remember, you feel confused or you feel lost. That is a risk factor, and also you have to take that as a signal alarm. A sense of indifference or apathy, as if nothing holds significance. That is an important sign, because in this stage it's important to have sense of life. You are in one different role, you are in a different stage of life, and also you have a lot of things to share and live in that moment, in this moment. So it's understand how I can restructure my sense of life. If you don't have, and if you don't feel this significance of life in this moment, question about it, and also take this as a other risk factor or sign of alarm. And unexplained physical discomfort or pain, this is one of the signals that I would like to recommend you to consult to the doctor or a professional help, because we're going to have some back pain or our legs will pain. That will be normal. But if it's constant and you don't have way to feel better with medicine or with therapy, it's important to complete one process with a professional, asking for these symptoms and what can happen, or even what is happening with your body. Also, feelings of sadness or hopelessness. In this case, I would like to also recommend you to ask or search for a professional help. Maybe it's important to restructure your life and understand that you are in a new stage of life. For that reason, you can have other people to help you in this process. Increase consumption of tobacco, alcohol, or drugs. This is important to change the habits. If you consume alcohol or if you consume drugs in your adolescence or in your young adult stage of life, it's important to change that habits, because now you are in an sensitive stage of life. In this stage of life, it is dangerous to still with that habit. So try to stop or even decrease the alcohol consume, or if you smoke cigarettes, try to stop it. If you before smoke 10 or more than 10 cigarettes per day, try to decrease that consume for maybe 5 or 3 cigarettes per day. Try to decrease that old habits and change it for new habits as exercise, move, and others that I'm going to share with you in the next minutes. And also, escalating angry, irritability, or aggression. This is an important sign and alarm because this will be maybe an illness or mental illness sign. It's important to consult to a professional. Persistent thoughts or memories that prove difficult to shake it off. If you are thinking all the time about something that is not really important, or even something that you can resolve at the moment, it's important to understand that is a risk factor. Maybe this obsessive thought can take you to not enjoy your life or even not enjoy every day. So that will be a risk factor. Auditory and hallucination or belief in unique things. It's important to understand if you have these hallucination thoughts or visions, consult for a professional. And contemplating self-harm or harm towards to others. It's important to understand if you are thinking to self-harm and hurt others. This is a sign alarm sign important. So try to understand that you need in this moment to communicate that feelings and that thoughts. You're not going to be judged. You're not going to be maybe seeing that you are not normal, you are bad. No. If you look for somebody or for someone that is professional, then you will have the provisional help, and also you will have continuous and a good therapy to complete during this process. For that reason, if you are a Shoe for Life member, you can have this benefit with us. You can ask for psychology counseling and talk about these risk factors if you already realize that you have or a person that is near or that you have maybe in your radar is having or maybe taking these risk factors in this stage of life. Knowing all these risk factors, it's important to understand that is inevitable the biological and physiological effects caused by the life, and also it's normal to have this decrease in our health, and also it's normal to understand that we are not young anymore. We have to accept our new stage of life and also our new body. This is a molecular change. We're going to have a new body, and also is normal. But also we have to take care of change the old habits and try to realize and have this new point of view about what kind of risks we can have in this moment and try to change it. Now, I would like to share with you before to tell you what can things are important or what can do to improve the health, this phrase is a phrase of Victor Hugo, is a greeter, and I would like to read it for you. As grace and wrinkles unite, a certain lovely emerges. In happy old age, there is an indescribable dawn. I like that phrase because it's something important to understand in this new stage of life. If you enjoyed your old life, your old life, you can see other way. You can have a new sense of life. So I have this phrase as an introduction to the what kind of things we can do to develop the health in this stage of life. So what it is healthy aging? It's not only talk about the physical activities as we talk about the last conference. Physical activities is important, but also in mental health we can do a lot of things, and also will be different if we compare the physical activities and versus mental activities. Here we will talk about the mental activities we can practice to develop the mental health in the old age. Now try to do these activities, and we will minimize the risk factors that we talked before as something common that we can engage in our life. Physical activity, mental activity as a new habits that we can engage in this new stage of our lives. Let's begin with promote involvement at home. It's normal that in one stage in of our adult life, we stop to involve to our grandparents in the life decisions or in the home decisions. So it's important to try to bring them to the home, and if they have or if you have children or grandchildren, involve to the grandparents in the meaningful family activities. Invite them or ask them, because I understand and I live that experience with some patients and also with people that I know, that they say, I don't know how to involve to my grandma and to my grandpa because maybe they will be angry or maybe they will be sad with the new of we have to change the home, we have to change of house, we have to move, or even we have to tell sad news, and we know that they will be angry or they will be worried about it. So it's important to understand that they have a role, they have experience, and they can give us an important advice. So try to involve them in the family activities. Maintain communication. And this is really important to stay connected with family members and friends all the time, or even talk about how you feel and a common day. I did this, or I ate maybe something that I really love to eat, and something that I didn't eat it sometime or for a long time. Something that is important for you, try to share it with your family and friends, and also use a different ways that we have now or to communicate, different channels. If your grandma or if your grandpa didn't know to use a phone, try to help them. And if they want to talk with a family they have in another city, try to call them for help, and also try to call them and help them, because you can do it, and also you can help them with that purpose. So try to look for ways to they can connect with the family they already have in other city or in other country. If they don't know how to use the phone or even the computer, try to help them with that task. And if you help with that task, I know that they will enjoy it, and also they will be so grateful to feel connected with their friends and also with their family. Other of the things that you can have in account in order to increase the mental health in older adults will be engage in shared activities. Look for this: 1/3 games, storytelling, watching television, leisure activities, or cooking. And this will strengthen the bones, and also they will give a different role. As I told you before, they can have an important role as a householders. And if they are householders, they can have this role, as I mentioned, associated to the older adults. So if you engage to your grandparents, to these family activities, as a storytelling or even cooking, that is something that you can enjoy as a family, and also develop the bond that you already have as a family. Also, we have other slack with some activities. Stick to routines. Maintain the routines as of sleep and meal schedules. Remember that we have to eat every 2 or 3 hours. Remember and have in account that meal schedules, and also your sleeping routine is really important to have a mental health in this stage of life. Provide orientation tools, calendars and clocks to help them to stay oriented. That's normal that our older people start to feel confused for the time and also for the days. They can ask you all the time what date is today, Tuesday, Wednesday, or also they forget to do some things that they already have scheduled, some medical sections that they already have scheduled for, 1 month previously. It's important to have a calendar, a big calendar, or remember if you have technological advantage ways to create a different calendar for them, where they can have this way to feel always in the same time, and also don't feel confused about where they are, what time is, and try to give them this feeling of feel secure with the way they can ask you, and also the way they can feel that you are also helping them to understand that it's normal to feel confused about the days and also about the time. So try to have a calendar or even maybe an alarm all the time. This is other important stage: spiritual engagement. As a family and as a friends is a different generation, so they have spiritual beliefs, and religion beliefs that are important, because most of these old people or older adults have a strength bond about connected with the belief, and also for they are important to still feel connected with that. So as a family, respect all the feelings or even the speech that they already have, and also if they want to go to the church and they are not maybe they feel confused in the route to go to the church, try to go with them and also give them the way to see the connection with these spaces, maybe through other channels if they can walk, or even if they can move around the city alone. Try to give some other tools to see or even to be connected through YouTube, or even through a video, or even through digital message. They can have it, and also you can be part of that, always through the love and also through the respect as a family. And other will be the mental agility exercises. You can have a lot of different exercises to develop your mental agility. Could be dominoes, chess, board games, word searches. That will be mental agility. As I told you in a before conference, the physical activity could be exercises, walking, swimming. In this case, will be different mental games. That mental agility exercise will increase also the this organ that we have. This brain is also an organ that we have to exercise in every single stage of our life, and also is more important in this old stage. And other one will be promote dialogue and participation. As I told you, it's important to understand that they are necessary, and also they can develop an important role in our family and also in our community. So try to involve them in the communication and also in the conversations that you have in your family, or even if you would like to take an important decision, take them and also bring them to the conversation without fear, and also understanding the point of view that they have. And it's important to recognize that the role that they have in this moment can bring a lot of experience to this conversation and also to the decision that you're going to have. Other is oppose immobility. Avoid prolonged periods of immobility. So try to move your body, try to count the hours that you are sit in the same place for more than 2 or 3 hours. That is important, because if you are moving all the time, your body will be in activities, so you can develop a different ways to increase the strength of your body. Also, we have the power of companionship, and this is one of the most important, because feel love and feel a companion by a friend or by the family during this stage of life will give you the enough support and also the enough strength to from this moment, because maybe you will have some illness and it's normal. But if you are in front in this conflict and complicated moment of your life with the support of your family and friends, is really, really important. Sometimes you can live with your family or with your husband and wife, and you can still feeling alone. Try to look for a person and also a person that you think that is where you can share all the things that you need to share it with the purpose of feel better, and also be careful and feel care about your life, and also feel care about your illness that you're living right now. So try to recognize what kind of people you have in your life that can take care of you in this stage of life. And one of the last is the professional support. Seek for professional support and help when you need it, because it's important to understand that in this stage of life we need someone that can give us this help, and also this treatment to complete it and understand what kind of things we have to do to feel better, or to understand this new stage of life that I am living out, and how to confront, how to structure, how to give a new project in our life. So try to understand that if you need, or if you recognize professional support, look for that. And now, finish our conference, I would like to read you an important idea. Healthy and independent aging elders who remain healthy and independent contribute to the well-being of both family and community. Psychological and emotional wellness is essential for their happiness, and therefore prioritizing mental health in older adults is crucial. If you have aging elders, you will have a health community, because it's something that will increase every single step. If you have health children, you will have a health community, and it's the same way in this stage of life. And it's important to have mental health as a priority in older adults, because we're going to have a lot of them in this new generation. So try to understand that we have to develop a new role for the older adults, and it's important to understand that we have the tools to bring and also create this role and give the meaning that is important to bring it, and also to give it to them. Knowing all this, I would like to remember you that we'll continue with this cycle. And for that reason, the next conference topic will be supporting the older people when they are dealing with a loss, and will be on September 20th. This will be our next conference and the next topic. And also, I would like to remember you that if you are a Sureful Life member, you have a great benefit without no additional cost or additional charge. There is 3 free sessions, counseling sessions for grief, individual or family grief, and also you will have 1 per year for any other reason. You can contact us through our different channels, WhatsApp, Facebook, Instagram. Even you can email us, and there you can find us as a Sureful Life in all these different channels. And as a final stage, thank you so much for being with us in this moment and also in this conference. Remember that we have other topic this September 20th, and give you all the thanks, and also feel so honored to share with you this stage and also this space. Thank you so much for your time. We'll stand by your side.